This is screencast number 5, Fatty Acids and Health Risks. Corresponds to slides 80 to 84 on the PowerPoint. This is an application of the last concept, which was types of fatty acids. And it reads, scientific evidence for health risks of trans fats and saturated fatty acids. So if you take a look at the notes there, bear in mind, while all types of fat consumed as part of the diet will cause adverse health effects if taken in excessive amounts, some types of fats associated with increased health risks. And the mix of fats in the bloodstream raises the cholesterol levels in your bloodstream, and that is a bad thing, especially as you age. Now, saturated fats and trans fats raise blood cholesterol levels, while unsaturated fats, they're cis fats, lower blood cholesterol level. All right, so you can see here the opening as we take a look at saturated fats. Saturated fats are contained in organ meat, animal red meat, muscle meat, their organs, liver and such, lunch meat, desserts, fried, anything, butter, pizza, ice cream. There is a positive correlation between high saturated fat and coronary heart disease. Coronary heart disease includes the big three: heart attack, stroke, and atherosclerosis. Notice the word correlation here. Never use the word causes. In IB, it is correlation because everyone doesn't get, even though their diets are rich in all of these meats. So take a look at LDL for a second, and that is the reason why. LDL stands for low density lipoprotein. We'll define that on another slide coming up in a couple minutes. And it raises that. And if LDL is raised, blood cholesterol level is raised. Not a good thing. And you can see your meats there, beef, it's okay for you every now and then. Fried anything, how about you bake your fries? And of course, candy, high in saturated fat. Notice here, though, 60% in 12 grams of. So it must be a big bar, but of course it's two servings in this container. How? Not good, not good. How about your trans fats? Trans fatty acids, remember, they occur naturally in products in cattle. They can be made synthetically. The combination of the two are bad based on what you buy at the supermarket. There's a positive correlation here between trans fatty acids and coronary heart disease. Why? Because trans fatty acids stay in the blood longer than saturated fat, and they cause arterial plaque, which causes atherosclerosis, which causes heart attack, which causes stroke. All right. It raises, again, the LDL, while trans fat also reduces the good lipoprotein, your high-density lipoprotein. We'll get to that now. So take a look at a couple of the foods over here that we're talking about trans fat. Your baked goods, cookies, donuts, cake, potato chips, pretzels, granola bars. Be careful of things that look healthy. And my favorite, Cheez-Its down there. I love Cheez-Its. So we take a look at the effects of the different types of fats on cholesterol level. Your normal cell, in a normal cell, LDL carries fats into your cell, HDL out of your cell. However, diets rich in cis, okay, can carry more because it's going to increase the HDL, bigger truck there, increases the HDL and lowers the blood cholesterol level. However, rich in saturated fat, notice a little analogy here, a lot more LDL, a lot less HDL, unhealthy. And then your trans fat, when you combine the two of them, they should make this truck even bigger. Your sick cell, and there your HDL is not being removed, significantly raises. So you can use this as a guideline. All right, let's talk a little bit about what LDL and HDL is. All right, both LDL and HDL are produced by the liver. Again, remember, fat does not dissolve in the blood, so it can't travel around as part of a dissolved product. So it needs another method of getting around your body. And the lipoprotein is that method, both good and bad. So LDL and HDL produced in the liver. Cholesterol travels in the blood attached to a protein. I'm going to read the note to you there. It transports cholesterol and triglycerides from the liver around the body and tends to deposit that fat on the artery walls, leading to atherosclerosis, heart attack, and stroke. It is your bad cholesterol. Meanwhile, HDL, also produced by your liver, does the opposite, cholesterol and triglycerides from the body to the liver for disposal. LDL bad, HDL good. So you're looking for foods that are higher in HDL and lower in LDL. Go on to our next slide there. Here you can see someone's, that would be me, someone's lipid panel. So notice at the doctor's office, you get your LDL, you get your HDL, you get your cholesterol ratio, overall cholesterol, triglycerides taken. And that is for somebody who has trouble with their cholesterol. There are drugs the drugs that are given are called statins, STATIN, which tend to help your body take cholesterol out of your blood. All right.